Hey everyone, I'm back with another video. So today I am going to show you how I take care of my teeth, and I posted on my wall. I didn't make a video, I don't know if I should, but I went to the dentist on last Friday, and I was supposed to go in 3 months, and I waited like 7 months. I was supposed to go back in I went in February. I was supposed to go back in like May or June, and I skipped out until August. But I have periodontal gum disease, and that is from different things that I've put my body and health through. I've been anorexic. I deal with anxiety and depression, and I was eating a lot of candy and sweets, and mainly candy and cookies, cakes, sweets all the time, and that used to be like 80% of my diet. Like, I would just feast on that, and I wouldn't really brush or floss, and if I did, it would be in the morning, and it wouldn't be for very long, and it would just be a clean swipe over with a toothbrush, and I would use like no Listerine, and I would barely floss. Like, it would hurt so much to floss that I would just put the floss pick in between my teeth like this, instead of how I normally do it. So I am in good hygiene health as of now. I went last Friday for an examination because of my periodontal gum disease. So every time I go in for a cleaning, they want to do an examination just to check my teeth to see if I have any cavities, or how my gums are looking, that sort of thing. This time my examination was excellent. My doctor and my hygienist was very pleased with my gums. They said there's been big improvement. I went from doing a deep cleaning, and my hygienist did it all at once, because before I went to the dentist the first time for a deep cleaning, I didn't see a dentist for at least 10 plus years. I know it was longer than 10 years since then. So it was a while. I had a lot of issues. I had a lot of cavities. I had broken teeth. My molars on top were broken. Molar on the bottom was broken. It was decayed. And then I had my wisdom teeth. I had 3 wisdom teeth. I had 2 up top, and I have 1 on the bottom. The 2 on top were decayed, so he just pulled them. And then on the bottom was a perfectly healthy wisdom tooth in the back. But like he said, because I have the periodontal disease, he pulled my wisdom tooth because he said if I got a cavity there, he would have just pulled it anyway because of the state in which my gums were in. So he did it, and each visit was an extraction. So altogether, I had 3 top molars on my right side pulled. That was one visit. I went to a surgeon that specializes in like anxiety driven patients. So they're very, very quick and it's painless. And before I had the chance to like freak out or, you know, tell them to stop, it was already done. Like it was like within a minute, all 3 teeth were out. And I had no pain and no soreness whatsoever afterwards. Like, you know, that was pretty fast but scary time. And then I went to the dentist that I'm usually that I'm seeing now, and he's great. He's a great doctor. I love him, and I just love his work. He's so thorough, and he also deals with patients that have high anxiety. So he is very patient, and he explains everything to you, what needs to be done, your options, and then he gives you the option whether or not to do what he's suggesting or not. And he's not going to push you, he's not going to force you, it's your choice. You can literally get up and walk right out the door if you want to. He's not going to hold you, he's not going to force your hand. You know, he's you know, he's just that way. And I appreciated that because I wanted that choice, but because of the state that my teeth were in, I knew I couldn't do that. So every week, I think I went for 8 to 10 weeks. I went every single week on Wednesday for an extraction. So the first dentist poured 3 on my right. He poured the top left because I had one that was broken on this side. He removed that. And then the next visit, he did all my wisdom teeth. So he poured this one on top, one visit, this another visit, and the bottom on another visit. And then this tooth here, that was another cavity, and it was a broken tooth. So that tooth actually broke from the inside, and then the outer shell of the tooth was just hanging there. So after I got everything done, I had mentioned it to him, and he poured it, and yeah, so that was all the extractions. And then I had to go every 3 months for I went for a deep cleaning my first visit, and then I had to go for a standard cleaning every 3 months. And I did that for I think 6 months. I went for 3 months, 6 months within that time. And then this last visit, I waited, I think 7 months, and I just needed a standard cleaning. And yeah, x-rays, examinations were excellent. He was very pleased with my teeth and my gums. And then my hygienist, when she did the standard cleaning, she also rinsed my gums out with the medicated mouthwash that I have here. And after she did the cleaning, I used Listerine, and yeah, I see her next February. So that's already scheduled, but I wanted to show you the state in which my teeth are currently, and then I'm going to do a routine with you on how I take care of my teeth, knowing that I have no cavities, my gums are healing, and I'm on the road to recovering my gum issues. So that's what it's looking like. I just use a standard manual toothbrush. I'm going to invest in an electric toothbrush and then a water flosser as well. So I'm going to purchase those soon. But yeah, I'm going to splurge and take the extra steps and precautions to keep my teeth as healthy as I possibly can, because I have that's all the teeth I have left. So I want to keep and hold on to them as long as I can. So I am going to brush and floss and everything with you, and yeah, I'm just going to show you what I do. So first, I floss. My dad bought me the platters with the microline. These feel better than these. I got those from the clinic. I have a little cut on my gums. I don't know if that was from the cleaning or I did it with the floss pick, but I'm just going to show you what I do. And yeah, so I start with the bottom and then the top. Very little bleeding, so I'm in the healing process. You see right here where it's cut and it's bleeding a little bit. Right here, the gum, because of the periodontal, that piece of my gum was lifted and it was a little flappy. It is healing. My gums are getting tighter, but it still is a little sensitive when I floss there, but I floss a little more there than everywhere else because that's where I need the more care. So a little bleeding. Back there is a little irritated. It hurts very bad. Like, I'm actually very, very sore right now. That's from the periodontal disease. My gums are still very, very tender, but I have to do this. I have to do this twice a day. So I do this in the morning and I do it at night. It is helping, but I'm hoping by the end of this week or beginning of next, the soreness will subside a little bit and it won't be as tender as it is now. But I'm not experiencing as much bleeding. I have a little bit of bleeding, but it's not where it's gushing. That's a molar. I got 3 molars left in my mouth and I want to hold on to them. I got no more up here and back there. I abused my hygiene as far as oral hygiene for so many years. And now we're going to do the top. So I start on my right side and work my way to the left. No bleeding. It's like a stabbing pain. You know when you get the shot to numb your gums? That's what it feels like every time I use a floss pick. And it's even worse when I use my toothbrush and I use a soft bristle toothbrush. Just a little bit of blood. Now I'm going to, I used this yesterday, the Crest 3D White. Today I'm going to use the Crest Pro Health Enamel Shield for sensitivity. Protects against cavities, gum, enamel sensitivity, plaque, tartar, white ants, freshens breath. But I need the sensitivity because my gums are like, they're so sore. And what I'm doing is, as I'm brushing, I'm doing like the circle motion all over my teeth, as if I'm using like an electric toothbrush. I'm making circle movements. That way the bristles are up against my gum, and it's at an angle like this. So I take a little bit of toothpaste. And I put it on my tongue scraper. Then I go in with my chlorhexidine oil rinse that I got from my hygienist. It tastes like spearmint. I just put a little bit where it touches that line. It has, when you first taste it, it has like a spearmint, but a spearmint type of taste, and then it's like, it kind of tastes like alcohol. So my whole mouth has like, especially my tongue, has like a, it just feels like I have alcohol on my tongue. And then I started doing this last Friday of my appointment, Friday night. So this Friday would be my last day to use this. I'm gonna put it under my sink. And then the remainder of the month, I'm gonna use my Listerine core mint. But every first of the month, for 1 week, I use this. That's why my gums are in such good condition. It tastes horrible. I'm going to try to distract myself. I'm gonna go outside. I'm going to clean a little bit. It takes like an hour and a half for this to like leave my mouth. So I'm just gonna let it sit, let it do its thing, and yeah, we're going to go outside and do some cleaning. I hope this was helpful. This is just my routine, and this is what I've been doing since my last deep cleaning. about a year ago, and hopefully this was helpful, and I'll see you guys in the next one.